so energy level is low, but I think I'll make sure in next 20 minutes I speak something which is valuable and you get some good insights on how the healthcare industry and the health insurance industry is growing across globe. So I'll keep my content very short and sweet, not going into more details, but I'm sure like in the next 20 minutes you will get some good insights. So this is the agenda. I'll be covering something on the overview of the global healthcare, a small introduction of Cigna Corporation, then the timelines of AI in healthcare, and then I'll be discussing few use cases, the generative AI use cases in the healthcare and the health insurance industry, and then we'll talk about the principle of the ethical AI in healthcare. So these are the 5 key items we are going to cover. So this is the global healthcare service market. In 2021, it was estimated at $10.3 trillion US. That's a huge, big number, which is expected to grow to 2020. In 2027, it is expected to grow at $21 trillion US with a CAGR of 8.7%. So these numbers are the accumulation of all the services across healthcare, which includes the hospital, clinics, the pharmacy, and all the related services which supports the healthcare industry. This is the numbers which tells about how big the healthcare industry is. It's more than the GDP of combining few top countries. The next slide is the number which talks about specifically the IT in the healthcare. So all the IT related services in the healthcare, it can be like the GCCs, they spend some money on the keeping their systems up and running. Then the allied services. So all the IT related services is around $395 billion US in 2022, which is expected to grow to almost 975, which is 3 times in just 7 to 8 years. So you can see how the growth of the healthcare industry is expected in next 6 to 7 years. So this includes everything like surveys, software, hardware, all the IT infrastructure, maybe like analytics for the healthcare or the IT related services. Everything is included. These are the numbers which you can expect by 2030. And again, there's a big number. So let me talk about Cigna Group. So Cigna Corporation is headquartered in Bloomfield, Connecticut, USA. It was formed in 1982. It was through the merger of INA Corporation and Connecticut General Corporation. Although the roots of this company is even more older. So these older companies were started sometime back in 1800s. Cigna offers, it's a multinational corporation and it operates in more than 30 countries, although Cigna's major revenue comes from the US market, but it operates in other 29 countries as well. And it serves over 200 million customers worldwide. Cigna offers a broad range of health services, including healthcare insurance plans, dental insurance, pharmacy benefits management, mental healthcare services, wellness program. It also provides healthcare service for individual families and employers of all size, as well as Medicare and Medicaid plans, especially in the US. Cigna has a vast network of healthcare providers, including hospital, clinic, physicians, specialists that are part of its network to ensure access to quality healthcare service for its members. Cigna has around the number is 75,000. So Cigna has around 75,000 employees worldwide, and it is ranked 15th in 2023 Fortune 500 list. Last year it was ranked 12th. It was above Microsoft in terms of revenue. So this is an introduction about Cigna Group. Now Cigna has their own GCC in India. So many of are not aware of it because right now we are small, we are growing. But like like UHG, which started back in 2000, started with 30 employees. Now UHG has more than 40,000 employees in India. They serve both the IT part, the BPO part, right? So Cigna is late, but latest in this race. So Cigna have their own GCC in India, which is based out of Bangalore right now. We are growing. So right now it's more, so right now the work which is done from the Cigna India is only on the analytics side and supporting some of the AI related work, but we are growing like, we have a plan to hire thousands of people in next 2 years. So it's going to be a space to watch out for Cigna India. Okay, so just quickly going through the timeline AI. So the first thing was this Dendral software, or the Dendral system, which was developed in 1960s. So this is how the AI started in healthcare. At that time, mostly the things were based out of the rule-based reasonings. Then the second thing, the actual machine learning algorithm that was applied in the healthcare industry was for medical image analysis. It was done somewhere between 1980 to 1990. It was used in the radiology and the pathology. It was the same time when this IBM's Deep Blue computer defeated the world chess champion Gary, making progress in AI's computational power. So actually this was the first time when this Deep Blue computer defeated this champion, people came to know what AI is. That was the first time. So time between 2000 to 2010 was mostly on the, which I'm just talking, relevant to the healthcare side. A lot of genomics sequencing was done. A lot of robotic assist surgery were done in this period. And all the EHR data, which is the healthcare data, was actually put into the IT site, and a lot of analysis were done on it. A lot of NLP techniques were applied to improve the clinical documentation, allowing structured data extraction from the unstructured data. So it was a time when a lot of things were happening in the healthcare space. Then comes 2010, which was the era of cloud computing, and then it actually gave wings to a lot of different areas on the AI side, on the because we had the computation power from the AWS, Azure, where you can actually go and do all your AI related stuff easily. So it was a lot of big data applications, a lot of healthcare applications were developed on the big data side using the big data infrastructure, of course. And IBM Watson was also one of the AI-based tool which was created in this period. Now talking about about 2020 onwards, a lot of things have developed in the last 2-3 years, and especially in next 2 years, a lot of things is planned on the generative AI side. So I'll just talk about one use case, 1 or 2 use cases I can talk about quickly. Like, we have a lot of contracts, especially when we talk about Cigna. So we have millions of contracts with different vendors, different agencies who provide pharmacies, right? We have a lot of contracts with the clinical companies in US, right? So we are in a process of developing a chatbot which will read all those documents and will be ready as an IVRS system to answer any query, or maybe as a chatbot to answer any query if you want to ask. So you need not to go understand the contracts, because contracts are 100, it goes to from 100 page to 200 page with a lot of complex languages. So that's the one use case, getting all the contracts ready and can be answered quickly within a fraction of seconds. We can actually go and ask, hey chatbot, I want to understand, we have a contract with this vendor. Can I do this or not? Am I eligible to do this X thing or not? And you get an answer within a fraction of seconds. So these are the few use cases on which a lot of healthcare companies are working on. The other use cases, maybe I'll cover it later on. So patient care, diagnosis, drug discovery, early detection, treatment personalization, and healthcare automation. These are the few areas where a lot of work is being done on the generative AI side. So ChatGPT-4 is one of the most used LLM right now. The other is BERT. We have a fine-tuned version of BERT, which we call it as BioBERT, which is more specifically for the clinical usage. So I'll talk about few AI use cases in healthcare industry. Many of them are already done by, so again, I'm focusing this session more on from the GCC perspective, how the global capability centers are working on these use cases. Maybe there are few service companies who have already developed these solutions, but my focus is more about how like the Cigna, UHG, or the other captive units are working on these specific solutions. So disease diagnosis is one of the area where a lot of healthcare industry or the healthcare companies are working on. For example, generative AI can detect lung cancer from CT scans. The algorithm can learn from a large CT scans data set and find patterns indicative of lung cancer. And generative AI can also be used in the diagnosis of skin cancer. The algorithm can learn from a large set of skin images and identify patterns which says, okay, this is possibly a case of a lung cancer or possibly a case of a skin disease. The other use case is a medical chatbot. So this is one of the actual use case on which Cigna is working. So what we're trying to do is, assuming a person wants to know if he's eligible for a shot or not, right? He calls, so right now what happens, he calls the call center, he asks, hey, I want to understand, I have insurance with Cigna and I want to understand whether I'm eligible for the shot or not, right? So that person goes through all the documentation, he understands what his insurance says, whether he's eligible for that or not. He may go and check some medical history as well and the answer is. It takes some time and a lot of manual effort is required, right? So we are in a process to make this whole process automated through generative AI. So we have the databases, the patient CRM database. We have the database which have all the historical records, the historical medical records, like what type of disease he was diagnosed with, but what type of medicine he was taking for last couple of years, right? Now, so now then when this medical chatbot is ready and the patient calls the chatbot and said, hey, I'm Alex and I want to understand if I want to take a shot, am I eligible or not? So within that model, actually, quickly uses a large language model. First of all, it goes and picks the data of the patient, checks the insurance, whether the insurance covers the shot or not. That's part one. Part two, it quickly goes, reads all the historical data of the patient and suggests whether, based on the past medicines that he was taking or any diagnosis that was done, he should take this shot or not. So maybe the chatbot can come with the answer, hey, Mr. Alex, based on your insurance policy, you are eligible for the shot, but we do not recommend you to take the shot right now because in last 6 months, you're taking X, Y, Z type of medicines because of this diagnosis, so this is not suitable right now. And the call closes within 10 to 15 seconds. So this is how generative AI is making sure all the patients get their answers within few seconds with high accuracy. Now, there are a lot of ethical angles are involved in it that we have to definitely take care of, but that's a typical example how medical chatbots are working. In interest of time, I'll just quickly go through. I'll try to finish in the next 5-7 minutes so that we have some time for the question and answers. So next one is drug discovery. I don't have a background for the medicine side, so I won't go into detail, but drug discovery is another very strong use case where generative AI is helping a lot of pharmacy company. A lot of pharma company are now able to they're creating new drug molecules that have the potential to be developed into a new drug. So it's again a watch out area for the pharmacy company or the pharma company where they're doing a lot of drug discovery. So next 2 years again, game changer in this space from the generative AI side. Managing healthcare costs. So this is one of the, in fact, this is the problem of all the industry, not only the healthcare industry. But again, now we have the potential to read all the PDFs, all the documents, and use some LLMs, right, to come up with the answers quickly. We have, generative AI has now made it possible to come up with some solutions to how to reduce overall cost. Now, specifically talking about the healthcare industry, the generative AI can analyze large data sets to identify costing opportunities, such as reducing unnecessary medical tests. So we can see if the similar test was done on a patient, maybe in last 1 year or 2 years, and then they use some of their own knowledge to see whether if this test is required or not, right? So we can reduce those costs. We can optimize the network provider contracts and identifying high claim cost claimants for their early intervention. So if we know, if we can really find out of these 100 people whom we have sold the insurance, who are the top 10 people who might come back and ask for a claim. So definitely we can reach out to them and understand and make, we can work out with them how to make sure they don't come us, right? I mean, we can prescribe them something of the medicine or some solution. Risk pool imbalance, so it's the same thing, right? If you have a number of people who are selling the insurance, if you can find out who are the people who may create an imbalance on your pool, right? You can reach out to them proactively and work with them to make sure they stay healthy. Complex regulatory environment. So this is another area, especially for the companies which operate in multi-national environments. So for Cigna operates in 30 different countries. Every country has their own complex rules and regulations, right? So now AI can really help us to understand. I don't know how many of you know, but a lot of things are happening in the legal side where AI is helping. So in India as well, there are few companies who have worked on the legal side where they know what all cases has been fought in Supreme Court, and you can simply go and ask, I want to fight this case. These are my, so you just talk about with that model, like this case I want to fight, right? What are the chances I'm going to win the case? And the chatbot will answer, like similar case was fought on Supreme Court or High Court in last years, and who won it or who lost it, right? So they have that information. So we have also LLM on the legal side, which can talk about what are the chances you win a case in a court, right? So just coming back to this, so there are a lot of legal requirements. So AI can, using some LLMs, we can make this more simple, right? Like example, we operate in Singapore. We want to understand if we are going with a new sort of product in Singapore, what are the chances that it may get into some legal complexities, right? So we can use AI, we have the LLMs, we have the data, we can understand quickly, and we can mitigate it. Automated claim processing. So most of the company have their insurance claim automated, but they are not 100%. So still there are manual intervention which happens. So this is another area to look for in next 2 years when we get end-to-end automated claim process. So person, like he applies on the portal for a claim, which goes to hospital, comes back, and everything can be automated end-to-end. Now again, we have to use some model, some large language model to get this automated. That's another area, end-to-end automation of the claim processing. Still, nobody in globally, I mean, no one used the fully automated claim processing. There is still a manual intervention which happens right now. IVRS for customer service. So this was something similar, like we can use NLP and generative AI sort of thing and come up with a chatbot. We can answer the policyholder's query, assist with the claim inquiries. They can engage with the customer in natural language, improving the overall customer experience. So now, many times it happens, our insurance are so complex, especially in the US side, you don't know whether you're eligible for this claim or not, right? And it's always tough to really go to a customer center and ask all these stuffs. So it makes things much simpler when you get a very summarized answer. mostly in a yes or no form with a small context, right? So this is another area where a lot of things are happening to support the customer services through generative AI. The other is the risk assessment. So it's a typical underwriting process. So it's mostly now used in industry. So a lot of companies have built their very strong solution around it, where algorithm can assess holders' risk more accurately by analyzing a wide range of data sources such as medical records, wearable device data, genetic information. So this is something which is now mostly done by a lot of companies. The next one is this is the interesting one. Many times so again, many companies have again developed this solution, but many companies are still in a process to develop it, where person asks you a question in his own native language, and the bot understands it and answers the same thing in the same language. So again, a lot of large language model, we are using it to make this happen. It is under testing, so we are doing it for a few countries as well. But when we talk about specifically to India, then it becomes even more complex. When you have so many languages, you ask the question in a different language, and you expect the customer service to provide the answers, in the same language, right? So you can use the some good LLMs to, come up with a solution for this. The next one is medical coding. So this is another area where cost reduction can be done. Like AI can assist in optimizing medical coding and billing practices, ensuring that insurance claims are submitted accurately and efficiently, reducing claim denials and payment delays. So that's another area which is being worked upon. Healthcare wellness program is now very common. Most of the health insurance company are coming up with this health and wellness programs. So these were some typical use cases. Few have been developed, few are in phase of POCs, few will get developed in next 2 years, but typically this covers a whole essence of the healthcare and the health insurance industries. In general, how it happens, like every company has their own list of use cases. So for example, Cigna have a list of 100 use cases that we're evaluating for the generative AI. For this year, we have selected 6 use cases. For next year, we have selected another set of 15 use cases that we'll be working upon. So in general, 6 months, 2 to 3 good use cases if we can implement in generative AI, then it's good. Because so again, the time, the essence of time is again important here. When you develop solution in the generative AI, it's not, you first make a, so gone are those days when you have 6 months or 1 year to generate or develop the models. Right now, especially in the healthcare industry, it is weeks we talk about. Like this solution, we have developed in 4 weeks, 5 weeks, 6 weeks, and we have to put in production. So you can understand how we need to do it and how efficiently we do it, making sure we are accurate. So I'm quickly covering the principles of ethical AI. Sorry, I think I'm over time. So especially there are a lot of industries like banking and retail, but if you see the industry which is more sensitive to the ethical part is the healthcare industry. You can if your customers' data, the healthcare data is leaked, it's a problem. And if you prescribe them some with wrong medicine, then you may end up in jail. So that's the most important thing is the ethical part in the healthcare process. So few points I just quickly touch upon. Transparency. So healthcare AI system should be transparent, and the decision-making process should be explainable to healthcare professionals, patients, and other stakeholders. What does this mean is, if my chatbot says you are not eligible to take this, you are eligible to take this injection, but we do not recommend you take this injection, then my chatbot should also have a context and summary why it is giving that answer. If I ask my bot, why are you giving me that answer, it should be able to explain me why you should not take this injection. That's what we call it as the explainability. The model should be able to explain why he has taken that decision. The chatbot has taken that decision. Second is the privacy and data security. Patient autonomy is another area. Patients should have control over their health data and be informed about the data will be used in the AI application. So that's very important. We should have to make sure patient knows that their data, personal data, may be used in some AI applications. Bias mitigation is another area. We have to regularly check our model is not biased towards any sort of ethnicity, race, or gender, right? So we have to make sure it is not biased to anything. Accountability, responsibility is another area. Clinical validation. So in ensure that AI-based diagnostics or treatment tool undergoes rigorous clinical validation and testing before deployment. The other areas are equity and accessibility, human oversight. That's important. So maintaining a human oversight in AI-driven healthcare process to make critical decisions, especially in complex and high-stakes situations. AI should complement, not replace human expertise. That's very important. So we have to make sure in whole process, at least somewhere humans are involved. May not be in few processes, but in general, they are involved and they have a control over it. Education, training, and public engagement. Involve patient, healthcare professional, and public in the development, assessment, and regulation of the AI in healthcare. Here I end my presentation, and I just conclude this session. Generative AI has many potential use cases in healthcare, including drug discovery, disease diagnosis, patient care, medical imaging, and medical research. While challenges need to be addressed, the benefits of generative AI in healthcare are significant. As AI technology advances, we expect to see more applications of generative AI in healthcare that will revolutionize patient care and improve health outcomes. However, some challenges, such as lack of interpretability, the same thing, like if a model is not able to explain why this has taken that decision, that's we call it as they are not able to explain their task, their decision. The need for large data set, the ethical concerns need to be addressed. As a technology advances, it will be essential to address these challenges and ensure that the benefit of generative AI in healthcare are realized responsibly and ethically. With this, I stop here. I have just 2 minutes left. If anyone has any question, I'm happy to take. Okay. Yeah, I can take. That's why I'm saying I have 2 minutes left. Someone at back.
Hello, good morning. Thanks for the presentation. I wanted to ask, like, for the health insurance policies, before a patient takes on a health insurance policy, there is a proper profiling of that patient done, right? The overall healthcare profile of that patient. So do we see any role of AI over there in that step? Or do you foresee in future?
Sorry, I couldn't understand the last sentence. So you're saying that when we give an insurance policy to someone, we do the whole profiling, right?
Yes, yes.
I understood from this point. Then next, what
And do we see a role of AI over there in that particular process?
Definitely. So look, if the data is available, that's what I'm saying. If that person's data is available, definitely you can use generative AI or the AI side to do the whole profiling, and you can really understand. So I think most of companies are doing it, like the wearable watch. It generates a lot of data about your health. If they have that access to that data, they can know, what should the premium of the person. If he's healthy, I'll put up a lower premium. If he's not healthy, I'll put up a higher premium, right? So that's something which is actually in use. If you have, the only thing is you should have access to the data of that person, the personal health data.
Okay, so it's already being used on a wider
It's
scale,
in
you would
use.
say.
Many companies are having that data and they're using it, yes.
Okay, thank you.
Thank you.
Hi, good morning. Just a quick question. You spoke about the wearable watches. Is that data actually accurate, reliable data, or you use data from the watches from brands which are considered to be good? Like, there's so much of data on these watches.
Yeah. So what we do is we do not get this data directly from these watches, or we get it from some third-party vendors who validates this data. So we make sure we have something in between who validates it before it comes to us. So it doesn't like we just go to say Apple or Herman or whatever the companies are, right? So we don't take data directly, but it's come through a third-party vendor data which is already authenticated.
Thank you.
Hi.
One more question, yeah?
Yeah. I have one question over here. Hello.
Yep.
Yeah. So my question is that, see, for determining the premiums, there are ways like there are use cases that based
Correct.
on the photograph of a person,
Correct.
can you calculate the BMI of the person, or based on the video, can you do some liveliness check how healthy the person is? So have you, in your experience, what is the accuracy of such use cases?
Those are mostly accurate. Look, everything cannot be predicted accurately, but still they are 90%, 80 to 90% accurate, based on the input they give, the photos that we take, right, the data that we have from third parties or whatever, right? So whatever they declare. So it's almost 80 to 90% accurate.
And are these use cases pervasive in the health insurance industry, or they are still nascent in the nascent stage?
No, these are being used. These are being used, yeah.
Thank you.
Thank you. Thank you. Thanks all. Hope I not wasted your 20 minutes. You got something new to know. Thank you.